The glycocalyx in the brain is 2 to 4 times thicker in the brain blood vessels, in the cerebral blood vessels, than it is in the rest of the body. So, and that's because we have a very specialized system in the brain called the blood-brain barrier that keeps more things out of the brain than are allowed into other tissues in the body. And the glycocalyx is a really important part of that.
Hello, and welcome to Legends of Longevity with me, Joseph Entz. I'm your host, and I'm thrilled to have you join me on this journey towards living a longer, stronger, and more vibrant life. The podcast is about uncovering the secrets to longevity, things your doctor does not tell you, whether it's groundbreaking advancements in heart health, lifestyle tips to keep you thriving, or inspired stories of people who've defied the odds. Together, we'll explore the tools, techniques, and mindset shifts that can help you unlock your fullest potential. Whether you're here to learn how to enhance your well-being, support your loved ones, or just stay ahead of the curve in health and wellness, you're in the right place. Let's empower each other to not only live longer, but live stronger. Welcome to another episode of Legends of Longevity. Today's a good one. I've known Dr. Burke for over a decade. She is impressive on every level. She's triple board certified family physician, functional medicine, and sports medicine. She's the medical director of True Health Center of Precision Medicine, where she focuses on identifying and treating the root causes of chronic disease rather than just managing symptoms. Her work centers on cardiometabolic health, dementia prevention, gut and immune dysfunction, mold-related illnesses, lifestyle-driven disease. She trained in family med at UC Davis and later expanded her expertise into functional and precision medicine, allowing her to combine conventional science with advanced biomarkers, genomics, and personalized care plans. She's deeply involved in education, clinical research, especially around metabolic issues, cognitive decline. Today, she is recognized for her patient-centered, system-based approach to healthcare, helping individuals prevent or reverse conditions like heart disease, diabetes, Alzheimer's, by looking at the underlying biology. And what that means is if you're looking for a doctor who can sit down with you and sort out the problems, this is one of them. Welcome, Dr. Burke. I am so grateful you're here because I've been wondering what's going on in research lately. I know you're involved in a lot of research studies. You work with a lot of patients on cardiometabolic issues, which is too much sugar or imbalanced insulin, and help them get on their feet. No, a good pun right there. And yeah, so what is that like, and what do patients need to have before they visit you, or what moral, emotional hurdle do they need to overcome to surrender to, I need to make a change?
That's such a good question because there's a lot of different reasons that people end up at our doorstep. On the one hand, about half of our practice is precision total health care. So basically replacing primary care with a precision medicine approach where we're looking not just at what symptoms do you present with, what disease may you have that we need to diagnose, but really looking upstream at your genetic vulnerabilities, at your environmental exposures, your lifestyle choices, and how all of those things interact together to create either illness or health. That is precision medicine. It's highly personalized. So like I said, about half of our practice is in that precision care group, and they're looking for optimizing their health. Maybe they have a family history of a disease, like you mentioned, my dementia reversal work. Maybe they have a family history of cardiovascular disease or cancer or whatever the case may be, where we know that there's a significant lifestyle and environmental component, and perhaps even a genetic vulnerability component, because the genetics don't make something inevitable to occur. They just create vulnerabilities that we then feed with our choices, our lifestyle choices and our environmental exposures. That then creates a situation in our bodies where that illness is more likely to be expressed than something else might be. So that's kind of the variety of people on that side of the practice. And then the other half is really about complex chronic disease reversal. So maybe it's someone who has a recent diagnosis, someone who's had a heart attack, or someone who has diabetes and they don't want to have that anymore, or someone who has an autoimmune disease, a chronic fatiguing illness. those are all things that we can use those same tools to unravel the root causes and help guide that person, hopefully all the way back to full health.
It is amazing to me how functional medicine providers, that's their default. They want to sit down and help and sort and educate you. This is what's killing you. This is when you feel great. But if you go to an insurance doctor or somebody who's dependent on that system, you're going to get a 10-minute appointment and a subscription prescription. Something you got to take and it's kind of a trap. So I bet a lot of people find you who are just knockered out, like just beat up.
Yeah, frustrated, especially on the side where we're helping people reverse complex or chronic disease that hasn't been, maybe they haven't had the attention to trying to figure out how they ended up there, or even sometimes with these types of illnesses, the system ends up beginning to blame the patient. It's your mental health, it's because you're depressed, it's this or it's that, when really it is the end result of this complex interaction of factors that now in 2026, we have the ability to test for so many of these imbalances in the system. And that's really where I think the watershed is. Because I was a conventional doc for 17 years. So I lived this world. I was that doctor. I said some of the things that make me cringe now. But that's how we're trained. We're trained to identify the disease process, to make a diagnosis, and then to apply the appropriate treatment and to manage that patient accordingly. That is our training system. And when you have an opportunity, as I did, to step back and retrain in another specialty, integrative medicine and functional medicine, I did both, then you have the opportunity to start to have that intellectual curiosity again, where all of the thoughts that you had maybe as you were learning in medical school, like, why does that happen? Like, why is hypertension idiopathic? Meaning it just happens. We don't know why it happens. Like, why is that? Because in my view, the body is designed to operate perfectly. And so if that's not happening, something has caused that to occur. And why? What is that? Why is that happening? So, I know all kids ask a million why questions. My mom said I was about 10x above any other children. So it was very appropriate that I ended up in this field that is literally all about asking why.
Yeah, and I'm noticing, and tell me if this is wrong, but medical training is somewhat parochial, meaning you're given a universe of knowledge that's kind of got walls around it almost. And you don't go into other people's specialty because that's rude. And you don't mess with other doctors' drugs they prescribe. But at some point it builds up to where you need a holistic champion to come in and say, all right, you're redundant on a couple of these things. You can fix this with that. And it's like computer code that just gets so messy over time. You need to simplify it. And I bet you have a lot of those conversations, especially with the testing, because you're building up a armamentarium, a friggin' of tools and tests that, the right test to the right person is all they need. You don't need to be super expensive and having a physician with that experience to kind of see the nuance. I've seen your situation before, and there's a lot of red herrings, things we could chase. But this is what you want, baby. I promise. Come back and see me in 30. That must be a satisfying job.
Yeah, it is. I mean, I feel like I have a lot more satisfaction and really passion for the work that I do because I get to see so many people get better. And I had, this week I had in my office for her annual exam an 86-year-old patient who I swear to you looks like a 70-year-old. She's still out having lunch with the ladies. Her social calendar is the most important part of her life. And it's so amazing because she's been my patient for well over 20 years now. It's just so amazing to know that I had a hand in helping her to achieve that quality of life at this age. And hers isn't a unique story. I mean, I have this awesome picture of a group of ladies that are all, 70s, 80s and up, and one who's 97 and up until about 5 years ago was still mowing her own lawn. Like, people they don't, we attribute so many of the things that happen to us over time that are really from these accumulations of imbalances and the environmental exposures and the lifestyle choices, and we attribute those to aging. But really, the piece of it that's related to aging is just that accumulation over time. So if we pay attention to those things, we can unburden the body of many of them so that we aren't weighed down by those things that are creating chronic inflammation, that are creating oxidative stress, that are damaging our cells, our tissues, our organs. So it's very empowering. This work is very empowering. It's empowering for me, for my clinical team. I have a group of practitioners that we all work together, and it's empowering for our patients to be able to see how much more control they have over their health outcomes than they ever thought was possible.
What's something that seems to mature in patients to where they feel that empowered? Is it just knowing I have more control over this problem? This was the problem. I misidentified. What gives them that satisfaction?
I think when people see, well, really probably what's the most apparent is as they see themselves and their own health compared to their friends and family members and colleagues. And they start to see over time this separation, like, I don't have those things. I don't have a list of medications that's as long as my forearm. I don't have, I don't have all of these chronic conditions, and I can do all of these things, and, this friend can't and that friend can't. So I think there's really, that is when you recognize that this is making a difference, because it is very hard to help people see that you've kept something from happening.
Oh, yeah.
It's easy to see when something is happening to you, but it's hard to know that that would have been your path and it didn't happen because you put all of this work in. That's harder to see, but you really can see it when enough time has gone by that you see that there's such a big difference between your experience and the experience of those around you.
Wow.
Also, when you go to your specialists and the specialist says, you look way better than most of the patients your age. I get that comment back a lot. In fact, I've had a couple of times over the last 10 years, I've had specialists say to me, why do your patients look like 10, 15 years younger than everyone else? And I'm like, because this approach works. When you pay attention to the right things, you can change the pace of aging.
You didn't say they self-select that way. What a flex that is. Your patients are healthy. What's up with that?
Yeah. I mean, there is some degree of self-selection for it, and it's not like we haven't had our share of disease because people aren't perfect. They don't do everything that we ask, and, we don't know everything yet. So there are obviously variables, but, case in point, we went 12 years in our practice without a single heart attack, not one.
Whoa. Oh, yeah. The world needs to know this. There are a group of doctors out there that have money-back guarantees. They have long records of no heart attacks and strokes. A lot of them went to one special class called Bale-Donine, and they're pretty hard to find. A lot of them are retiring, but in the 2010, 2000, it was not sponsored by pharma companies so much, a little bit, but it was some doctors with incredible recall, brain recall, and they put on a class, and I went to it, and it is drinking from a fire hose for 3 days. They go through all the research. They have eidetic memories that way where they can just pull and tell you the story behind the research. Like, well, that study was funny because, anyways, the doctors who went to that offer confidently heart attack, money guarantees, money back guarantee, heart attack. Nobody knows about this. Heart attack and stroke is preventable. It is manageable. In a lot of claims, a lot of strong claims that it's reversible.
Yeah, absolutely. Well, a couple of years ago in 2024, I published a study in Integrative Medicine, a clinician's journal, IMCJ, showing, it was a case series, and we looked at regression of carotid plaque using a supplement called Arterosil. The active ingredient in that is rhamnin sulfate, and that is a building block component that builds something called the endothelial glycocalyx. It's a part of the inner lining of the blood vessels, and when that gets damaged, then the wall of the artery can become damaged and plaque can form. Because plaque really is inside the arteries is really like a scab on the outside of your body. It's a tool the body uses to try to heal an area or to try to stem the damage that's occurring to the vessel wall. So initially something that's meant to be a healing patch then later on can become more of a problem if the wounding and the injury continues to happen. And that's where we have the ability to intervene. Because if we can stop the reason that that damage is occurring, or we can alter it, and then we can provide the building blocks to repair, we can actually literally see regression of the plaque. In my conventional career, I never saw carotid plaque go the other direction. It had one direction, and that was to increase. And then you just monitored it until it increased to the point that you needed to do surgery. And that was kind of our toolbox. And of course, we were using all of the medical management tools. We were using statins and, all of the things controlling blood pressure. But even with doing all of those things, we still had progression. In fact, that was one of the reasons that I ended up in this field at all, because I had a booming family medicine practice. I had one of the largest private family medicine groups in our town. And, we were delivering babies. I've delivered 500 babies in my career. I've done a lot of different things. And I started to notice that I was really just managing my patient's decline. I was doing everything. I was following the guidelines. I was, amping up the meds. I was getting the markers that I was taught to follow. I was getting those under control. And then I would have someone have a heart attack. And I was like, what the heck? Like, why is this still happening if we're doing all of the right things? Well, if you ask why, the reason must be because we're not paying attention to all of the things that matter. That's why there's still residual risk when you're taking a statin, for example. There's lots of examples. So that was part of what started, generating this intellectual curiosity that I wanted to understand why these things were happening. And I was one of those early Bill Doneen devotees. I went through that training. That was part of, about the same time that I was starting to learn functional medicine, which is a systems biology approach, understanding how all of the different parts of the body work together to support each other or to not support each other, which is how we end up diseased. And so that was really where I learned about focusing on vascular inflammation as the root cause of the event. So the cardiovascular event, the heart attack, the stroke, the sudden cardiac death, most of those occur because of an inflammatory plaque rupture. I'm sure you've talked about this before. But our approach is all about progressive clogging of the pipes. Right? Looking at plaque accumulating, and that's the thing that we're paying attention to. What's your cholesterol and how much plaque do you have? But if we're not paying attention to, is that plaque inflamed or not inflamed, which is something you and I do together, right? When we're looking at the CIMT and we're looking at the character of the plaque, and then I'm measuring in someone's blood the markers that are specific to vascular inflammation and, risk of plaque rupture like LPPLA2 and myeloperoxidase. When we look at a bigger picture and then we do things to change those risks when we identify them, we get a different outcome. And it's an amazing one. Yeah. Well, I've been doing this now for almost 15 years. And about 10 years in, I was giving lectures. About 5 years in, I started giving lectures about it. So I've been lecturing on this for over a decade. And in the lecture, I would talk about the statistic in medicine, depending on who you read, somewhere between 13 and 17 years it takes between when something is basically proven in the research literature to when it's incorporated into clinical practice. And I spouted that statistic many, many, many times. But inside, I thought, is that really true? That can't really be true. But now here I am 15 years later, and this is still not common practice. And so I'm living that statistic. And I can't explain it. I can't explain why there isn't more curiosity about this, or even, when I talk about it with colleagues that are conventional, they're like, oh, that's really interesting. And then they move on. It's like, what? How do you not want to know how I accomplish that? I think maybe either they don't believe it, or they think I'm overstating it, or I don't know what the explanation is, but it's just, it is It is a bit flabbergasting, really.
Yeah, somebody once told me that medicine changes with dead bodies, the doctors more than the patients. And I thought,
Yeah, I've heard that too, right? Academic medicine changes one funeral at a time. Yeah, yep.
right, and I don't want to think there's nefarious reasons. I mean, we know that pharma companies have their reasons, but there's a lot of good healer doctors out there, like where they genuinely want the best, but they just kind of get in a track and this is what I think works, and they're not too creative and they don't want to explore or try something new with a new patient who's tried everything else. And it's sad. It's sad. And the insurance doesn't like you trying new stuff either, it seems.
Yeah. Yeah. No, I mean, you've got the whole, what are the guidelines that, we're intended to follow, and you have the medical research is largely funded by big pharma. And so that's the direction of investigation. That's what, people are looking into. And so, that in part, like you and I were talking about earlier, is one of the things that made this research study that I just completed, the dementia reversal clinical trial, that made it so exciting, because this was, it was supported by a single investor, the Four Winds Foundation, and the trial is called Eventhea, Precision Medicine Approach to Mild Cognitive Impairment and Early Alzheimer's Disease. And we had the opportunity to do a randomized controlled trial, the gold standard, and have a control group and have our intervention group. And we completed that trial at the end of October, and we just closed everything up this last month. And the results are just really, they're nothing short of astounding. 91 to 92% of our participants in the active treatment group had improvement in their cognitive function, which again is another chronic disease that has historically had one direction. It's just degenerative decline. We had improvement. We had statistically significant improvements in multiple domains of cognitive function, in executive function, in composite memory, in processing. Yeah, all of these different domains. We had dramatic improvements in reduction in cognitive symptom scores, both self-rated by the subjects themselves, and then also externally rated by their study partner, generally their spouse or a loved one that lived with them. We had multiple improvements in health domains. We had improvements in weight, in BMI. We had reductions in hypertension, people getting off multiple medications because they didn't need them anymore. We had improvements in blood sugar and insulin resistance. And in pain, we had one subject who was scheduled for 2 joint replacement surgeries who ended up canceling them both because he didn't need it anymore. Yeah, really remarkable health outcomes. So I'm so excited. We're just about to submit it for peer review to the Journal of Alzheimer's Disease. They published the pilot study, which was what enabled us to be able to do this RCT. And but the preprint is out. I'm sure we'll link that in the show notes.
God bless you. God bless your hands. Right? You hear about incredible therapies like that. Tell me more about the therapy itself.
So what we did was a precision medicine approach. So we did all of the things that we talked about at the beginning. So we identified lifestyle changes that needed to be made in diet. We used a ketogenic diet that's been shown in multiple studies to be beneficial for neurodegenerative conditions. And so we used a ketogenic diet. We had people start exercising. Yes, people in their 70s started exercising. We followed their sleep, making sure that they were getting enough sleep, that they were getting enough quality sleep, because during deep sleep, that's when that lymphatic flow in the brain is rinsing out the toxins and the metabolic waste. We taught them mindfulness practices and stress management. So we did all of those lifestyle interventions. Those have been actually published already by Dr. Dean Ornish. That was also back in 2024. So those lifestyle interventions have been shown to create improvement. And then we layered on top of it all of the precision diagnostics and then interventions to bring those biochemical markers or systems that were out of balance into balance. So we addressed things like metabolically driven inflammation, that partially with the diet, partially with some, supplementation, helping people build more muscle mass. We looked at their nutrient sufficiency, their mitochondrial effectiveness. We looked at oxidative stress and inflammatory markers. We looked at chronic infections and toxins like mold toxins, heavy metal toxins like mercury and lead, and chemical toxins. And then we also looked at hormone balance, and we brought people's hormones back into balance. And by doing all of those things, treating the system, not treating only the one identified problem, by treating the system, we got remarkable results.
Wow. I was waiting for you to drop, and we added in this one drug. But you're saying by being healthy and paying attention to the details, you can get those kind of results with some hormone therapy.
Yes. And we did not eschew conventional medication. So if something was needed, like if there was a subclinical chronic infection and we needed to use an antibiotic, or we had a fungal overgrowth and we needed to use an antifungal therapy, or if someone in our assessment of their cardiovascular risk appeared to have a lot of vascular inflammation and was potentially at risk for an event, we might have even used a statin in that instance. But we used medications for very specific targets rather than just to lower cholesterol, for example. Because you could have someone that has a relatively high cholesterol, let's say 240, and you check their carotid CIMT and they do not have plaque, and you do a coronary artery calcium score looking at the plaque in their coronary arteries, and they don't have evidence of plaque. And that person has a very, very small, if any, benefit from using a medication to lower their cholesterol. Because the purpose of lowering the cholesterol is so that we don't make plaque and we don't have the bad outcomes that can come with that. But if your patient is already not creating that outcome, does that medication really benefit them? In our paradigm, we thought no. So we wouldn't use it in that instance, but you may use it in a different instance. It's all about the personalization. That's what precision medicine is about. Right? It's not about what happens to a group of thousands of people if you give them this drug. Some do better, some don't, but on balance, more of them do better. Okay, so then we need to give everyone this thing. We're looking at what specifically, in the context of this person's genetic risk, their environment, their lifestyle, and what's happening in their physiology, what's the best choice for that person? That's precision medicine.
Wow. And so how long till AI can do that and replace all the doctors?
Oh, that'll be a long time. What I think AI is going to be amazing at, because this is very complex work, and that's in part why I think there aren't a lot of us that do this. It's a heavy cognitive load. It requires a lot of time. Spending time either with people or on their case is not what's supported in our current medical model. It's a volume-based model where your role is to identify problems and apply the appropriate treatment so that you can try to help people have a better outcome. But it's not about reversing chronic disease. That model, I think, works very well in acute care. Like if I'm having a heart attack, I want a cath lab. I want to be able to have this acute intervention. I want the medications that are needed to protect my heart muscle to save my life. But we've tried to apply that model to chronic disease care. And what we're seeing from the explosion of chronic disease is it doesn't work. It doesn't work to wait until the disease develops and then apply treatments to it, because it continues to progress. But what works, and what we're demonstrating over and over, and what we've just published in preprint and hopefully in the journal here coming up this year, is that when you turn your attention to those drivers, you can completely change the outcome.
Wow.
I love that I leave you speechless.
Right, like, I'm just trying to wrap my head around it, how fooled we were with medicine. So, like, I scan a lot of people and I'll say, all right, you got 40-50% blockage. A cardiologist doesn't want to see you yet. The vascular surgeon doesn't want to see you yet. But a lot of docs are like, I'm not quite comfortable. I'm a family practice. I'm not prevention. I don't do that. So the Mr. Patient man's like, all right, well, I need someone to help me with prevention. So they go to the cardiology because that's what they would think, right? Cardiology is going to, no, baby. They are masters of patching you up and getting you back out on the street again. There is no preventative program. They're not going to talk to you about sugar. They're not going to talk to you about lifting weights. They're not going to give you any tips. If you're lucky, maybe there's a nurse practitioner or a professional there that runs the program, but there's like 12 cardiologists and one nurse practitioner doing. It's just not built into the system is what I'm saying. Insurance doesn't pay. So if you want a doctor, a badass doctor who's going to sit down with you and be like, what's up? Let's look at some stuff together. She'll ask you questions. He'll ask you questions, run labs, precision. What's up? And you'll find it. But another thing you said, I wanted to talk about the Glycocalyx. We can end on that. But you were talking about how the application takes time. Like, that sucks because we're trying to do volume. You can't do volume and quality at the same time with healthcare, it's looking like.
Right. But another way that you could look at it is we need volume because our population is so sick. And that if we can peel off some of us to do this deep preventative work, then down the road, we will not need so much volume. But we have to start somewhere, right? Like we have to get a wedge in the system. And that's what we're creating here at our center, right? We want to be that wedge. We want to be the diversion track that takes some of the people off of this path of chronic disease, increasing pain, fatigue, having less energy to do things, not enjoying your life as much. And then ultimately, that terrible time of that couple of years of decline before death, which is the path that most people take. And we want to divert those people into vibrant health until the end of their life, which hopefully comes quickly in this model. That is what our desire is. That's what we're aiming to achieve.
I feel like we're at the age where healers are going to be unleashed a lot more because since 1913, the medical system's gotten rid of herbology, which I think we're missing that right now. That was pretty important. We're missing a lot of the natural therapies, the old world tools. I mean, we even forgot that eating food in the right order can really blunt your blood sugar from taking off. So the way Grandpa used to eat with dessert at the end, and I'd eat dessert first. I know that's wrong, but a protein to blunt it all. Like there were a lot of knowledge in the old ways that we dismissed with fast food that is so disappointing to me.
Mm-hmm. Yeah, I mean, the whole food destruction path is an entirely another conversation. But yes, I mean, we allowed what was food, that's what our grandparents or maybe our great-grandparents called it, was just food. It didn't have to be organic because everything was organic. That was just food. But now we have all of these different designations. Is it GMO? Is it not GMO, right? Is it organic? What's the pesticide load? And all of those things just add to the burden that the body has to deal with. So whether any one of those individual things is poisonous or not poisonous becomes a little bit, it's relevant, obviously, but it becomes a little bit less relevant when it just becomes around the massive amount of that stuff that doesn't belong in our bodies, that good, bad, or indifferent, the body has to process and try to get rid of it. All of that is very energy dependent. So it requires a lot of energy. That means the cells have to produce energy. That means you need to have enough nutrients. Well, if you're eating food that's not full of nutrients, right? Like you can start to see how all of these things feed on each other. And that's the systems biology approach. It really comes down to this process can't happen if this isn't there. That isn't there if you're not eating the right kinds of foods. Right? Your cells aren't efficient at making energy if you're never exercising. So your capacity to make energy is lower. And then if you look, for example, at neurodegenerative disease, which is highly dependent on healthy blood flow, getting back to our Glycocalyx, that's part of the protective blood-brain barrier, but it's also dependent on two other things: chronic inflammation, which creates the damage to the brain tissue, and the lack of energetics to repair or defend. And so those two things are, as Dr. Bredesen likes to say, the network insufficiencies that create the situation in which the cognitive decline and other neurodegenerative diseases develop. So if we can think upstream for that 10, 20, even 30 years that we have while this process is developing, we can absolutely have an opportunity to change that path.
The energy you describe is what every patient wants. How do I get some more energy? I'm clobbered all the time.
Yeah, well, I mean, I'm 60 years old and here I am getting all riled up and excited talking about what I do because I have a ton of energy. I have a ton of energy to do this work. I'm passionate about it. I see the amazing results. Like you can't even imagine what it is like to have a patient with dementia who is at the phase where they have that blank look, and we all know what that's like, especially if you've had family members affected by that disease. I've had 3. And it's just the point where you look at them and you can no longer connect with what I think is the soul of that person, right? That energetic connection is gone. The first time you see that wake up in someone because of your work and the work that they've done along with you and that their family has done, I mean, it does take a village to get all of this done, but you see that come back. Like there's nothing like that. You can't go back from that. You can't decide like, oh, this work is kind of hard, I'm not going to do it. Like it's amazing. It's a miracle.
You're telling me that when you go to the grocery store, you almost drown in high fives because you save some lives, and like that must be a regular for you to get a radical change. And they're eternally, like you're right, their soul was trapped or gone or not there. It was inaccessible. And everyone agrees that's the greatest thief in all our lifetimes. Take the money, take the car. My mom, my brother, I want them back. And yeah, that would be a rush to provide that.
It is a rush. Yeah, it is. I mean, it takes a lot of hard work to get there. It's not an easy path. But it's amazing. And even when we can, because we can sometimes get people all the way back to normal. And those are home runs. And we had quite a few of those in the research study. Amazing. Sometimes we can get people from a place where they can't feed or bathe themselves, or they can't remember the names of family members, and we can improve that where those quality of life things can come back, and that's still life-changing. The earlier that we can intervene, like that very beginning place when people are like, I'm not as sharp as I used to be, but it's just aging. Oh, I'm forgetting my, keys, wallet, phone more than I used to, but it's just aging. Or worse, all of my friends are the same. So I'm just like everyone else. No, I'm sorry. Half of us are going to end up with dementia. So if you're like everyone else, you are in that half. If you want a different path, then this is what you need to do.
Yeah, the average American dies of a heart attack or cancer. It's like, I would rather not be average.
Yeah, absolutely. Absolutely.
But how accepting everyone is, too, of it. Like, this is the path.
Yeah, it's the path. It's just what happens. I know. I mean, whenever in my community I hear of someone, dying suddenly of a heart attack, and I just think, like, I probably could have prevented that. Like, it's just so hard, and it's like, we're right here. Just come.
Yeah. Isn't that sad? It's disappointing.
It is disappointing.
Do you...
But you help the people you can.
Yeah. Yeah. You and I, you're probably one of the best experts on the Glycocalyx around. So we're going to use some creative words to try to describe, and I want to understand it better because I'm into media. That's my bag. I'm good at that. I know that world pretty good. But as of a few years ago, we discovered there's a layer on top of the intima media, and it's got these little hairs that blow in the wind of your blood flow, and they're negatively charged. Like, we're almost at the quantum level. We're so small. They're negatively charged so the red blood cells don't stick. But if you eat too much sugar, you abuse your body too much, they get nubbed down, and they can't protect you like they used to. So you're telling me that there's more to do it, because we know these little hairs do signaling molecules like nitric oxide, which for exercise or reproduction are very important, men. And you want to keep that tuned up. And the one thing I like telling my doctors is that I'm the carotid. It's a pipe that splits into two. And as the blood comes up, there's little eddies in the stream. which affords the opportunity to tear down that glycocalyx. If you have, let's call them nefarious molecules, whether it's nicotine or too much sugar, whatever, every heartbeat, there's a little bit of irritation if you have these bad molecules in there. And so the glycocalyx in the last few years has really become very important because that protects your vascular system from damage, those little missiles going into the wall when the glycocalyx is clobbered. And then the plaques form. And once it's clobbered enough, they start out like blisters. They're liquid filled, they're gelatinous, they got a little cap on them. And if they pop, that little bit of goo turns into a giant thrombus clot, which goes up your brain or heart or lungs. It's a bad day. So we want to make sure that you have plaque. If you do have plaque, we want to make sure it's calcified or at least secure as possible. And there's a whole life cycle in there, from soft, blistery to calcified nuggets that snaps like chalkboard chalk because it's so dense with calcium. So that's my knowledge on the intima and the glycocalyx. Tell me more about the glycocalyx because you've been studying it. You've done research studies. I participated a little bit in them, but you're getting results.
That was a really great explanation, actually. I love that. So if you think about it, so the inner lining of the artery is like many of our interfaces is one cell layer thick, the endothelium. Those are called endothelial cells. And so for a long time, we thought the endothelial cells were the thing that was creating that main barrier that was, deciding what, nutrients got through, what oxygen got through, and all of those kinds of things. And then as digital image resolution improved and, the laboratory techniques improved, we were able to see, well, at first we could just see that negatively charged layer. There was like this empty space when you looked at the wall of an artery where the blood was flowing here, the wall of the artery was here, and then there was this gap. And so at first they thought that it was just charge that was keeping things apart. And then eventually it was discovered that no, it's this layer called the endothelial glycocalyx, these fibrils, and they are very negatively charged, which is what repels the blood. It's actually part of what moves the blood because biomechanically, there isn't enough power from the heart to move the blood through the entire system. So we have to have this secondary pump system that's created by this electrostatic force. That's one of the jobs of the endothelial glycocalyx. One of the other jobs is that it harbors some of our clotting factors, so that if the wall of the artery gets damaged, it can repair it quickly because obviously bleeding is an enemy to life. And then it also plays a role, like you said, in nitric oxide. So the flow, I like to imagine it like a kelp forest. So the pulsatile flow of the blood, that gets transduced through the attachment of the fiber to the endothelial cell, and that stimulates the production of nitric oxide. And nitric oxide's role is to relax the artery. That's part of our blood pressure control. So remember we were talking about why does idiopathic hypertension occur? Well, it's not idiopathic. It is the end result of the things you mentioned, high blood sugar or, stress, nefarious molecules that have damaged the endothelial glycocalyx, that have decreased our ability to make nitric oxide, that have created chronic inflammation in the wall of the blood vessel that's made it stiffer so it's not as elastic anymore. That's how you get hypertension. So then the next question is, well, what are all the things that create that process? And then that's how we can start to unravel whether it's vascular plaque or it's hypertension, it's cognitive decline, it's arthritis and autoimmune disease. Like people often ask us, like, how can you treat all of these different things well? And it's because I'm interested in the diagnosis only in that it tells me where your body failed. But what I need to understand is how you got there. And that is a much smaller list. And so I can treat all of these things because the root causes are all very similar and they get expressed in different people because your genetics determine where your pop-off valve is. So for this person, it was hypertension. For this person, it was their metabolism and they got diabetes. For this person, it was arthritis, or maybe it was an autoimmune like rheumatoid arthritis or Crohn's disease. So all of these diseases are just different ways this stuff gets expressed in the human body.
So you're telling me that the heart's not powerful enough to pump the blood through the whole body. So, sorry, this one opened my mouth.
There's too much resistance. Yeah, there's too much.
And so the glycocalyx has this little ion layer that is like a hyper lubricant to get that blood through there. I didn't even think of that. That's amazing to me.
Well, this comes back to, which would take us down a whole nother rabbit hole, but I love the biochemical rabbit holes. I mean, this takes us into Gerald Pollack's work on the fourth phase of water and the exclusion zone, where we have the water lines up a certain way, and that also creates negative charge. So they work together to basically create, it's like a magnet, right? Like if you're holding the magnet towards the metal filings, then they're going to move even though you're not touching them. So it's that same concept that's being used in the blood vessels to kind of assist the pump portion, because the heart's the pump, right? And then we have this assistance that's helping to keep it moving so that it's not pumping against too much pressure.
All right. And then the glycocalyx is everywhere. Like it's microns thick, like computer chip. It's tiny, tiny, tiny. And we weren't able to see it until last couple decades because it's so small.
Yeah. It would take 1,000 layers of glycocalyx to be as thick as a sheet of paper. It's really, really thin. So yes, we could see that something existed, but we couldn't see what it was. Now we can see exactly what it is. And it is most highly damaged by sugar. So sugar is the poison for chronic disease, because that's the fastest way to damage the glycocalyx. But on the plus side, the glycocalyx also has an amazing resilience. It can repair itself very quickly. And that's where having the right building blocks for that comes in, because then you have the tools to repair it.
Fascinating. Because it grows back.
Well, and the glycocalyx in the brain is 2 to 4 times thicker in the brain blood vessels, in the cerebral blood vessels, than it is in the rest of the body. So, and that's because we have a very specialized system in the brain called the blood-brain barrier that keeps more things out of the brain than are allowed into other tissues in the body. And the glycocalyx is a really important part of that.
I didn't know that about the brain. There's a thick barrier. Wow.
Very thick barrier.
Sugar. Preach more about sugar. And like, there's more sugars out there with more names to fool us.
Yeah, there is. Yeah, so, I think we are so accustomed to everything that we buy having added sugar. And the more exposure you have to sugar, the less that you have awareness of how much there is. Beautiful case in point, when our first foreign exchange student came and stayed with us, she was like, everything is so sweet here. I can't eat that. I can't eat that. And this is before I knew functional medicine. We would kind of, roll our eyes a little bit and like, okay, whatever. I mean, that's just food. But right to our earlier conversation, we had no idea how much our food had been co-opted. And then she asked me, why is your cheese orange? And I was like, because it's cheese. That's how it looks. And she's like, no, there is no cheese that looks like this.
That's not natural.
Where I come from. And we were like, really? And so then I Googled it, right? Like, why is cheddar cheese orange? And it's because they color it. Like, why? So anyway, that was the beginning of my awakening on sugar. But
wait a minute, that don't add up.
That does not add up. Like, why? Well, it was just so interesting, like that these things were being questioned. And then I was like, maybe I should question more of this stuff. And then, right, that leads you down that hole. But back to sugar. So when we get an excess amount of sugar, just more than what our body needs, so what's supposed to happen is sugar then it's the glucose component of sugar that we use, and we take that stimulates the insulin to be produced, and then insulin sends the signal to the cell, telling the cell, hey, food's here. Open the door, put your GLUT4 receptors up so that you can accept the glucose and bring it into the cell. Well, over time, when there's too much of a sugar signal, first we get lots of insulin, and then the cell's like, whoa, like this is way too much insulin signal. I can't handle this. And it starts to shut the windows, like we don't want to hear this anymore. So now you have less ability. That's called insulin resistance. now you have less ability for that glucose to get into the cell. Well, what does it do once it's in the cell? It's what we use. It's like the gasoline for the tank. It's what we use to make energy. Energy in the body is ATP, but we have to use glucose, or that's our primary fuel that we use to make it. So now you have this whole process where excess sugar has created insulin resistance. So that's when your blood sugar is high, maybe your insulin's high, but your hemoglobin A1C is in that medium range, or maybe in the pre-diabetic range. Don't be fooled. Pre-diabetes means that you have diabetes, but you haven't crossed the finish line yet. So just ignore the pre, think diabetes, because that's the path you're on. But when that happens, now the cell has less capacity to make energy. So how does that feel? You feel less energetic, you feel sluggish, you get tired more easily, but people accept that as what? Aging? No, it is not aging. It is the accumulated effects of, in this example, excess glucose that leads to a series of events that diminishes how much energy your cells can make. Now, over time, think about what other consequences that could have. Well, in the brain, it means you don't have enough energy to repair something that's been damaged. You don't have energy to power your immune system. Well, that's true in both the brain and the body. If something breaks down, I don't really have enough energy to fix that, so I'm just going to let that be. That's partly what's happening in the arteries as plaque is forming. Because in a healthy body, it would see like, oh, plaque is formed, I need to go heal that. In your lack of energy body, it's like, meh, I don't have it, I don't want to fix that. And then before you know it, the whole house is in disrepair. And we call that aging.
Like it just builds up over time and you accept it, but
yeah, you accept it because you don't see the little things that are happening over time that are actually creating that process.
That must be so frustrating for you to help some people. They get an amazing turnaround. You're like, all right, patient number 4, I got a plan. It's gonna make you rise and walk. And they're like, no, I like my sugar too much.
Yeah, it is.
That would be demoralizing.
It is. Yeah,
All right, so keep going. But sugar, like your gut biome tunes up to the foods you eat, right? And I just put this together. So if you eat a lot of sugar, you're multiplying that sugar bacteria, which isn't lovely. And it's not so great. But if you can get on a keto, paleo, you get your body burning fats and protein, you think cleaner, you feel better, you have more durable energy, we can call it. But your metaphor of the body, like that's a problem. Another day, we're not feeling it today.
I don't got it. I don't got it in me today. So so if you catch it early, you just need an anti-inflammatory, modified Mediterranean diet. If we wait until the house has burned down, i.e. you're bringing in your, family member with Alzheimer's disease, and now we're trying to do this heavy lift from the house burnt down, like that's a lot harder work, and it's going to take different things, right? It's going to need a lot of supplementation because this person's body can't make what it needs to heal. It's going to take something like a ketogenic diet, which is an alternate fuel source. So ketones are another fuel source that the body can use to make ATP. It's not our primary fuel source, but it can be. And once you've developed this insulin resistance, which isn't just happening in your body, it's also happening in your brain. Now, like we said, the brain doesn't have the fuel to repair. So if we're asking it to repair, but it has no energy to do it, it's like asking the car to start with no gas. Like it doesn't matter how bad you want it to start, it's not gonna start. So if we can provide this alternate fuel source, then we can turn the engine over, we can start to get things online. And then we can see improvement. And that's basically how we do it.
So you can live on fat and protein. You don't need carbs or sugar at all. And in fact, some people do that for optimizing their diet.
Well, okay. So the strict answer to that is yes. Is that likely the best way to live your life forever? I don't think so, no. And it's for the reasons that you mentioned earlier, which is about the microbiome balance. So, part of what we have to do in precision medicine is we have to prioritize what needs the most help now. And so we may need like a ketogenic diet, which is not necessarily the best for creating a robust microbiome. But first we have to have energy. Then we can start working on other things that we can do to support the microbiome. We can use probiotics in the meantime to help, generate an environment. The gut-brain piece is critical. I mean, we haven't really delved into that, but you cannot have a healthy brain without a healthy gut. And you can't have a healthy vascular system without a healthy gut. So it's really critical, but sometimes we have to take things in the order in which we have to bring them back online, kind of like bringing a big factory back online. You can't run the conveyor belt on the delivery packages before you've turned on the power to, generate the product, right? Like it has to happen in a specific order.
Fascinating. Do we have time to talk about Cartogenics, this new product by Calroy that I've heard good things about? Regrowing cartilage. I've got an employee with a shoulder and he's getting on it, and we're optimistic. We're hearing really good things.
Yeah, we're seeing really good things. So the study that was published looked at people with rheumatoid arthritis and treated them with the active ingredient in the commercial product that's called Cartogenics. And what they saw was over time with that treatment on the x-rays, there appeared to be a bigger space of cartilage. So more cartilage appeared to be present. Now, it wasn't looked at with biopsy. So, we don't have like a thickness, but that was just an initial finding. It also doubled the pain-free walking time that those patients could accomplish, and it reduced their pain scores by about half as well. So that was a really exciting, start into this. Obviously, other research had been done before it was in, this human trial. So, but what's interesting is that we don't just see improvements in the joints, because the active ingredient is a specific part of an anti-inflammatory herb. Back to your comment about, botanical treatments from Boswellia serrata. And that active ingredient is also highly anti-inflammatory. So we see other inflammatory improvements in the body as well, which, if you can give me a little leeway here, going back to our whole gut thing and talking about how diet changes your gut microbiome, we have bacteria in our gut that are responsible for our GLP-1 signaling. So if we eat a diet that's high in sugar, that's low in fiber, that's low in nutrient density, and we create a microbiome in the gut that does not support those bacteria, guess what we lose? We lose our GLP-1 signaling. So that's how we are naturally designed for that signaling pathway to work. So again, if we look upstream, like how is this supposed to work naturally in the body? Is that suddenly everyone on the planet has a deficiency in GLP-1 and needs it externally provided to them in a shot? Probably not. Is it effective? Absolutely, because it's natural. We make it. It's supposed to be part of our physiology. It's just we're using it in a very non-physiologic way, which concerns me long term, and I don't want to get into all of that right now, because I think it definitely has a place where it's very, very useful. I think it has a place where it's being overused, and then I think we have this tremendous opportunity to figure out what we've done that has taken away that natural signaling pathway, and what can we do to restore that, because that's the ultimate solution to me. Not if you're looking for pharma profits, but to me, the ultimate solution is restoring what God created.
Holy cow. So we're going into the realm of peptides and GLP-1s.
We probably shouldn't go there.
Yeah, peptides is just too new. I'm getting into it, but there's just too much to know, too much to read, and I've got a few guys lined up to talk about it. But peptides being small amino acid chains that your body naturally makes, this whole industry is forming to leverage that. And they've got healing factor ones, they've got joint ones, nerve ones. Like it's coming along nicely. It's just too new for a stodgy guy like me to jump in real fast.
Well, and then again, where do those come from?
China.
Us. They're natural. That's how we know about them.
Yeah. And so
So is it that we all need a stack of peptides? Maybe in the current circumstance, or is it that we need to restore the way our bodies made them naturally?
Totally agree. But however, on the macro level, these are so promising, this new class of drugs, the peptides, that the FDA and the pharma companies are making moves to change the law, to privatize them, so they see money, but you and I see these are natural products that have high impact, low consequence on the negative, and they're worth playing with. But I sense regulation and big players getting involved.
Yeah, I do too.
Love it. All right, Dr. Burke, you do good work. You save lives. You stamp out disease. You're not afraid to use your brain to solve a problem. And I will tell you that you're one of the few, there's a few in every city. I'm sure there's more that I haven't found, but I call them the healers. They usually enjoy biochemistry because they're nerdy like that. And it gives them an intuition for what's going on. And they're curious. They've got a mind for it. And I love discovering doctors like you. I've known you for a long time, but to the public is what I'm saying is they're out there. You may have to find them, look for them. A lot of them don't take insurance because they want to help you. And they're handcuffed if you have to stick with insurance too much. Dr. Burke, you do great work. You save lives. And I really love the vision of you going through a grocery store and someone that you pulled from the drain comes up and just that would be a satisfying job. So congratulations and good work.
Thank you so much.
Thank you, Doc. Be well. Talk to you next time.